Good evening. Thank you for joining us on the Ontario Pharmacists Association's first webinar of its kind to discuss disruption in the pharmacy profession. I'm Andrew Gall, Chief Executive Officer of OPA, and I'm joined in our webinar studio by the Chair of OPA's Board of Directors, Mike Cavanaugh, and OPA's Executive Vice President and Chief Pharmacy Officer, Alan Malik. Before we begin, if you're having any technical issues, the quickest solution is to contact WebEx at 1-877-944-6338, ID number 664-997-752. You can also email us at education@opatoday.com, and we can also attempt to do any troubleshooting that may be necessary. On today's webinar, we will be discussing the changes or disruptions that we've been witnessing in the pharmacy profession that have been thrust upon us, some very quickly, and others that have been percolating for some time. Individually, each disruption impacts pharmacy professionals and how they deliver care to their patients, and how owners and managers conduct their business. Collectively, disruptions are quite significant, and in some cases can make or break a pharmacy operation. Over the next hour, I will act as your host and present questions to both Mike and Alan, to which they will respond. We'll spend 30 minutes discussing the current trends and issues we're seeing, and then we'll open up the floor for questions. I'm thrilled to tell you that we have more than 900 viewers on this webinar, so it's likely we won't be able to get to all your questions. We'll take as many as we can in 30 minutes, and we will endeavor to answer the ones we don't get to and post them on our website. The next couple of slides provide us with context and illustrate the transformation that has taken place over the last decade. In 2006, the Ontario government announced an outright ban on pharmacy rebates. While these were replaced with carefully defined professional allowances, these too became restricted for very specific uses. In 2010, amendments to regulations under the Drug Interchangeability and Dispensing Fee Act and the Ontario Drug Benefit Act added professional allowances under the term of rebates, thereby effectively banning them in Ontario. This has mounted to the removal of about $750 million from the Ontario pharmacy ecosystem. In October 2015, once again, the Ontario government used its majority to pass regulations and policies that would see mandated funding cuts amounting to $150 million per year for a 3-year period. And it's expected that this could continue. Fast forward to 2018, where we only are in April, and already this year is shaping up as being one of the biggest transformations in pharmacy. January saw the introduction of new challenges to pharmacy sustainability. OHIP Plus welcomed a program that no doubt provides greater access to medications for the under 25s with either insufficient or no drug coverage. The $465 million program will result in a significant revenue loss to community pharmacy. January also saw the launch of dramatic minimum wage improvements, and while this was not a hit solely targeting pharmacy, it impacts all sectors. It is yet another major cut to pharmacy. Changes to brand or patented drugs are also on the horizon from the Patented Medicine Prices Review Board that will impact pharmacy bottom lines. But perhaps the greatest impact of pharmacy have been the changes that you're all dealing with now, in one way or another, from the Pan-Canadian Pharmaceutical Alliance, which have decreased pricing on almost 70 commonly dispensed generic drugs, which I will speak to later in the presentation. In the March throne speech and provincial budget, the Liberal government announced an enhancement of OHIP Plus that would see the eventual elimination of seniors' deductibles and co-payments beginning in August 2019. This is something on which OPA has been lobbying for many years, and we welcome this as a way to provide greater access to medication. It also positions all pharmacies on a level playing field and ends any competition on price specific to seniors. Pharmacies will need to compete based on service and relationships with patients and customers. But we're not done on this, as we would like to see this implemented this August, not 17 months from now, and we'd also like a guarantee that this is not another instance of pharmacy picking up the anticipated $575 million a year price tag for it. New reporting by payers under the Health Sector Transparency Act will also have significant impacts to all healthcare providers, including pharmacy business, individual pharmacists, and associations, including OPA. Throughout the consultation period, which just ended, OPA has been extremely active and vocal on this file, given the complexity, confusion, and potential for unintended consequences. We are pleased to announce that the government acknowledged our concerns and recently extended the deliberations on the draft regulations until fall 2018. We expect to work with whichever government takes power to further understand the impacts to pharmacy and the overall health system. Ensuring that we are transparent to the public is an important endeavor and one that we support. But this is a landmark legislation, provincially and nationally, and will require additional thought, process, and time to consider its impacts to ensure that the original intent of the legislation is reflected, to support and respect transparency. Let me stop there and ask Mike to reflect for a moment on some of these changes. Mike, this is a lot of change in a short period of time in the pharmacy profession. You're a community pharmacist. How are you seeing these changes impacting your business?
Thanks, Andrew. As you know, I recently opened a new pharmacy in the Kawartha Lakes area. Despite these frustrating changes, they're coming at a time when I feel that our services as pharmacists have never been needed more. In fact, some of the clinical services that I'm implementing in the pharmacy include flu shots, travel vaccines, synchronization, pharmacogenomics, smoking cessation, and even meds checks, as cumbersome as they've now become. In addition, I'm working closer than ever with the pharmacy technicians who enable me to streamline our workflow so we can provide services to our patients. With more than 4,500 pharmacies in Ontario, we're often the first point of contact for many patients. Pharmacy professionals can do much more to improve or optimize the health outcomes for patients. It just seems as though we're being expected to do more with so much less, and OPA recognizes this burden on pharmacists. We've already seen tangible evidence of our value. Take flu shots as an example. In 2012, with just 600 pharmacies participating, we administered 250,000 flu shots. This year, pharmacists gave approximately 1.2 million flu shots in 2,600 pharmacies. Local pharmacies are convenient healthcare centers. There's one pharmacy for every 10,000 Ontarians in a 2-kilometer radius. That's pretty amazing, and it means that our accessibility and experience can help patients even more, and it's when and where they need us and close to home. It's one of the reasons I've opened another store. It's also why I'm adamant that pharmacy professionals should be allowed to do more. Surely we can offer travel vaccines, but why not all vaccines, including publicly funded shingles vaccines for seniors? Other provinces can assess and treat common ailments. There's nothing stopping us in Ontario except government regulations and fair and reasonable funding. And given the strain that we're seeing on the ER departments in hospitals and delays in seeing a family doctor when you need to, patients support pharmacists taking on more in this area.
Thank you, Mike. Alan, let's bring you into the conversation. You have a lot of experience with policy in the pharmacy profession. What about the recent changes in the generic pricing framework? As you know, our members support making medication more accessible, especially to those most vulnerable populations, but this is making a big dent in pharmacy. What are your thoughts on this, and do you have any recommendations to help pharmacy professionals weather the storm?
Thank you, Andrew. The Pan-Canadian Pharmaceutical Alliance calls for a reduction of 25 to 40% of the prices of about 70 of the most commonly prescribed drugs in Canada. In some cases, that's up to 90% of their brand name equivalents. How can anyone say this is not significant? It's been projected that the impacts are expected to reach an annual savings of up to $3 billion over the next 5 years right across the country. That's a noble cause, no doubt, if indeed these savings are used to bring more medications to market for the benefit of Canadians. But what of the unintended consequences and the business casualties left behind, specifically pharmacies and the generic industry? This is indeed frustrating, especially on top of the long list of cuts we've endured dating back to 2006. What is crystal clear now is the fact that our funding model is completely unworkable in a patient-focused health system. Ontario pharmacy is seen solely as a cost to our government and not as a profession to invest in. You are not being acknowledged for the tremendous value you can bring in terms of system efficiency, nor are you recognized for your skills, your expertise, and training to improve patient health outcomes. Pharmacy revenues are largely dependent upon the dispensing of a product, and there's little opportunity or financial incentive to shift to a more patient-focused care where cuts are the order of the day with zero investment in the profession. And we are now seeing the impact of generic price reductions. no recognition of the losses you are realizing with the drop prices and absence of a washout or opportunity to release existing inventory. There's no recognition of the ramifications of price depreciation and lost revenues and markup. With the exception of Dalton McGuinty's minority governments going back to 2011 to 2014, all of the cuts we've endured and continue to endure have been introduced by a majority government. There is little leverage to be had by an advocacy organization like OPA with majority governments, and that is why this June's provincial election will be very important. In the meantime, we can only live with the here and now. It's a good time to review your current workflow, inventory levels, and staffing to ensure you're maximizing potential revenue from all possible professional services while carefully managing inventory levels. Consider how your patients might benefit from med checks, travel vaccines, or pharmaceutical opinions. Review the OPA's suggested fee guide to look for opportunities for billable services that can also help your patients. We are indeed at a crossroads, and we need to find different ways of doing things. Bruce Croxon from the TV shows Dragon's Den and The Disruptors will be at our conference in June, and this month we feature him in the Ontario Pharmacist magazine. He talks about the need for pharmacy to adopt new ways of doing things and not waiting for other decision makers to dictate our work. On first blush, you might object to this, thinking it's impossible to do because healthcare is highly regulated. And while that may be true, conceding to the status quo solves nothing. To survive, you may need to look at things differently and to innovate. Look at Uber and how it revolutionized transportation, and Apple and the music industry. Pharmacy must transform itself. This is a precarious time for our profession, but that may also bring out the best in us. I'm excited about the potential for pharmacy to play its greatest role in healthcare yet.
Thanks, Alan. I think we all agree it's definitely an exciting time, but I know you are also realistic. There are some pretty big obstacles being put in front of pharmacy professionals today. Mike, perhaps you can weigh in. What do you suggest?
Well, it's a simple answer. It's get involved with your profession. And the best way to do that is to join OPA. And it's something that I've been saying for a while. As your advocacy body in Ontario, we need your voice and involvement in our discussions with the ministry on projects like MedsCheck. We're going to once again try to reshape it and have a program that is patient-friendly, but also provider-friendly. And by that, I mean actually doable in a busy pharmacy environment. Less restrictive and more flexible, and capable of driving better health outcomes and system efficiencies. Simply just make the program better. We also need your help in participating in new projects and initiatives like those led by practice researchers such as OPEN to help demonstrate our value. OPA also remains very active in driving pharmacists' role in primary care through our membership in the Ontario Primary Care Council, in mitigating the dangers in addiction and overdoses with our current opioid and pain management proposal, and our representation on the Opioid Emergency Task Force, just to name a few. We are doing a lot, but we need you to help us deliver the message and embrace transformation, and that pharmacy professionals can provide tangible solutions to some of healthcare's biggest issues. Right now, OPA is 10,000 members strong. We support more than 64% of the pharmacies in the province. The pharmacy sector employs more than 60,000 people in Ontario and has a direct impact of $6.3 billion. This size and breadth can have a huge impact at Queen's Park, but we need it to be louder and stronger. As OPA's chair of the board of directors, that's my goal for the organization and the profession, to grow our membership so strong that politicians and policymakers have no choice but to hear our message and can consider how we can shape the future of healthcare in Ontario.
Thank you, Mike and Alan, for providing our audience with perspective and analysis. Let's open up the webinar now with your questions. As I mentioned, we have many, many viewers, and we will try to take as many questions as we can and group them together where we can. So let's go with one of the first questions. And so one of our audience members that are participating are asking, why should I be an OPA member? Doesn't OCP represent me and the best interest of the profession? So I'll turn that question over to Alan.
So I guess the best way to answer this, the Ontario College of Pharmacists is the regulating body for the pharmacy profession. And as a result, it sets the standards and regulates all pharmacy professionals in Ontario. OPA is the voice of the profession and works with government and pharmacy stakeholders on a number of different projects, and we represent the interests of pharmacy professionals. This includes preparing submissions for government consideration, but also conducting research, thought leadership with our partners in the profession and our members, and providing tools and resources such as our practice support network to support pharmacy professionals every day.
Thank you for that, Alan. Now, another question that's come through, if a new government is elected, so June 7th is election day in Ontario, will the strides you've made with government be lost? And I'm going to turn that question over to our board chair, Mike.
Thanks. It depends on a number of things. First, it may depend on whether we have a minority or majority government. This is obviously something we're watching very closely at OPA. We're trying to keep our pulse on the political landscape right now. As we know, a majority government makes a big difference in how consultations happen, and it'll be significantly different if we have a different government. That said, I think it's important for everyone to know we've been working closely with all three major parties in Ontario prior to the election. And you may have seen on our Twitter feed how we had some leaders from all three parties in at the OPA office presenting just about a month and a half ago. So we're trying to keep pharmacy top of mind of every party and try not to just focus on who we think will win an election. And with any new government and the new players in governments, there'll be new relationships that need to be forged, both at a political and a bureaucratic level. And OPA will strive to keep doing those things and keep our priorities, keep them informed of what our priorities are for our members.
Great. Thank you very much, Mike. Now, a bunch of people are asking this question, so I'm going to turn this one over to Alan. I don't want to expand my scope of practice. What is OPA doing for me besides advocating to change my pharmacy practice?
Well, thanks, Andrew. It's an unfortunate question to hear, but I certainly understand it. OPA is advocating on your behalf on a wide number of files. And while that advocacy deals with scope of practice quite often, it also deals with our work on fair and reasonable funding for the services you provide every single day. That includes dispensing. And quite simply, we're also looking out for pharmacists' interests by advocating very hard for changes to and for fairness under the Employment Standards Act. We know, and we've heard loud and clear, that wages and benefits are very serious concerns right across the profession. Unfortunately, while we have raised this matter with government, they quickly acknowledge that they don't pay pharmacists, employers do. And that is why we're advocating for a new funding model, one that actually works and appropriately recognizes your value and your worth to the health system, but also one that is fair to businesses that employ you. As different as all these issues seem, all of our advocacy issues are interrelated, and it boils down to enabling you to do what you need to and want to do for your patients while acknowledging you as a valuable part of the system and the business that employs you.
Thank you very much, Alan. Another question that's come through. I'm currently a pharmacy student and feel my curriculum doesn't reflect current pharmacy issues and trends. Are you, as OPA, working with the schools to develop new courses and teaching modules? Mike, are you able to respond to that question?
Sure. Thanks, Andrew. I'll speak first as a pharmacy owner. Instead of wanting to shape how students are taught, I usually let students shape how I should be practicing pharmacy. And I encourage any owner or any staff pharmacist as well to take on students, because you can learn a lot by having a student in your practice. It's amazing the skill sets these individuals have from both schools in Ontario right now, and we should be embracing that. And we do work closely with the pharmacy schools on a regular basis. We often make some recommendations and liaise with faculty representatives. and the Canadian Council for Accreditation of Pharmacy Programs. And we also have 2 students, one from each of the colleges or the universities on our board. So there's constant feedback and information from the students right now. And as a student, we just also encourage you to advocate for the curriculum you deem appropriate. If you're finding, especially new grads, if you're finding that there's gaps, then I would certainly consider getting back to your faculty on it as well, because you're the best people to know what those changes and impacts were.
Thank you for that, Mike. Another question, some people are asking, they like what they're hearing, and how can I be more active as an OPA member? Do you want, Alan, do you want to jump in and help respond to that? Because people want to be engaged and help, and how do you suggest they can be more active as an OPA member or consider being a member?
Let me try. Just by being an OPA member, you're already lending your credibility and your expertise to our greater voice that we need to have with our government partners and our stakeholders. And for all members out there, we thank you for that support. There are many ways you can engage with us. If you haven't already done so, I'd invite you to visit the dedicated website, www.ontariopharmacistcare.ca. And where you can send a letter to your MPP on any number of topics that we've discussed this evening or any others that seem to be top of mind to you. We would strongly consider strongly suggest that you consider joining at some point the OPA board or one of the committees. We have a number of committees that we're always working with, looking for guidance and support, and these committees actually provide direct advice to our board of directors on the very issues that are challenging to the profession. We ask you and invite you to engage with us on social media. Tell us what you're thinking. Tell us what needs to be done from your perspective. We're always looking for ways to connect with active members in social media, and we welcome your retweets or your posts. Come to our conference in June. It's a fantastic way to get involved, to not only gain professional development, but also to interact and hear and interact with your colleagues and share your thoughts, your challenges, your best practices. You may even want to be able to be a speaker or a sponsor at our conference. Volunteer with us to help with writing an article in the Ontario Pharmacist magazine, or very simply, it's just a matter of sending us an email at communications@opatoday.com to help give us some let us hear your thoughts and your ideas, or if you have any other ways you'd like to engage with us.
Thank you for that, Alan. A question I'm going to ask Mike to respond to relates to the minimum wage changes, and how are pharmacies responding and managing with the changes to minimum wage? Any advice or next steps that you can suggest? And Mike, given that you are a pharmacy owner, you're in the trenches and you're dealing with this right now. So some of our members and non-members want to get some advice from our board chair.
Thank you, Andrew. So I can only speak of what we're doing personally in our stores. We've made a commitment to not reduce staffing based on the minimum wage increases. So we're going to try to absorb it through other means. And the first thing that we did was obviously go through our expenses line by line and tried to find areas that we could trim back. And I mean, it's not easy, especially when it came on the heels of the Pan-Canadian announcement. So it's a difficult process to do, and I appreciate that each store kind of presents its own unique problems. But I can definitely say that what we're doing most right now is trying to find ways to improve our workflow to help reduce costs in terms of, or I guess probably the best way to phrase it is to get the most out of every prescription or service so that it's being done efficiently and effectively. So we're looking at novel pharmacy practices like synchronization that I mentioned before to try to help reduce how often you're dealing with a patient, because if you're coming in and getting a prescription, one prescription every 2 weeks, it's a lot of labor involved. Whereas if you can streamline them and have them coming in once every 3 months and getting everything, it actually does make a significant difference on your workflow. And the biggest thing that we've we're continuing to try to expand is how we utilize pharmacy technicians. I think that they are completely underutilized in our profession. We actually have at our one store, we have 2 registered technicians, and we're getting 2 more. And we are using them more on compliance packaging. We're using them more on synchronization, and we're trying to get them more on counseling of devices to try to just eliminate where pharmacists are involved in that process as much as possible to allow us to spend our time on other revenue generating aspects of new practice, if you will. So it's really about how do we change, or how do we shift from the old model that we all have kind of grown to accept in pharmacy, and try to come up with something new that allows you to really try to get more revenue based on other aspects of pharmacy as well.
Thank you very much for that, Mike. One of the questions has come up based on transparency. So what does the government mean by health sector transparency, and what does it mean for pharmacists? Alan, I'm wondering if you could respond.
Transparency is definitely no question. It's a challenging topic. It's also very confusing. Quite simply, transparency is the government's desire to kind of track and understand where monies are being paid, particularly to those who are involved in patient care decisions. So this was originally targeting payments being made to physicians, most notably simply because they are the ones that are prescribing the medications that you are dispensing. And there may be some thought that there are influences that are dictating which medications are being prescribed. And so the government has expressed its desire to gain more transparency into what pharma, amongst other payers, what pharma is spending with doctors to influence prescriptive behaviors. However, this has expanded to include pharmacy because there is some belief that payments made to pharmacists are also having some degree of an influence on dispensing patterns, which medications, which brands, which medications are even being recommended by a pharmacist. And so there's this sense that the monies being paid to pharmacists are having perhaps an undue influence. Therefore, the government is seeking to have all payers of any types of what are called transfers of value, making those payments visible. So payments that pharma companies are providing to pharmacists as speakers at conferences, in terms of marketing programs in their pharmacy. These are all, there's a long list, and if you check our e-blast that we sent out, it will talk about some of the different types of transfers of value. This has a very large ramifications for the pharmacy profession, for pharma, for physicians, and our fear, given the complexity of this, is that such transparency and making these payments public are going to perhaps go the other direction, and it may actually suppress investment in healthcare, pharma investment in physicians and in pharmacy. This is very concerning, which is why we took a very strong position. This also will have very big implications to pharmacy business owners, because they are not only recipients of certain types of funding, they are also payers of certain types of transfers of value, and this is going to have a very dramatic and intrusive level of documentation to business owners.
Great. Thank you very much for that, Alan. Another question's come up, election time. Who do you recommend I vote for, and what should I say to my MPP? So first of all, OPA, we cannot give you any recommendations on what party to vote for. However, what we will be providing is a summary to all of our members of the party platforms from the three major parties. And right now, the NDP just released their platform a couple days ago, but we are waiting for the other two parties to actually provide their full platforms. And what we will be providing is a table summarizing the three-party platforms as it impacts pharmacy. So that will be coming out once that information is available. But what we have also sent out to our members a few weeks ago is a MPP outreach kit with key messages. So the key messages that we're asking our members to resonate when they speak with MPPs would be to enable pharmacy professionals to expand their scope of practice and deliver a broader set of funded services to patients, alleviating pressure on the rest of the healthcare system. We're also suggesting that you invest in pharmacy and transition to a new funding model, one that supports a service-based approach in pharmacy and allows pharmacy professionals to serve the needs of their patients according to their full set of skills. And thirdly, proactively engage with pharmacy professionals, include their expertise and perspective on healthcare matters. So in the MPP advocate kits that we did issue, it does provide the key messaging. It also gives you some tips on how to reach out to your MPP, make those appointments, as well as it provides you with a feedback sheet to summarize your meeting that you can share with us so that we can follow up with government. It gives you some script and key messages, and it also provides you a fact sheet on pharmacy stats, as we were talking about 60,000 employees that are in the sector and the $6 billion annual economic impact. So it does give that information. If you miss that in your email, certainly send us an email and we'll share a copy of that with you. The next question is, and I'll have Mike respond to this one, is the OPA looking to work with other insurance companies to get pharmaceutical opinion and Green Shield Canada cardiovascular counseling and smoking cessation services covered? Mike?
Thanks, Andrew. The short answer to that one is yes. So we do sit on a committee called the Pharmacy and Health Insurance Steering Committee, which is a pretty unique committee in Canada where we do have a close relationship with the national body that represents insurers. And we meet quarterly with them right now, and it's ourselves as well as CPHA and the National Neighborhood Pharmacies Association. So there's pretty good representation on that committee from a broad scope of pharmacy sectors. And originally, the biggest topics we talked about was expanding the reimbursement levels for professional services within pharmacies. So that's where we started this committee out, or the steering committee began. And we did actually come up with a suggested fee list that pharmacists could actually charge patients either individually out of pocket, or the first soiree into this space was we recommended that you ask patients if they had health spending accounts, and that these services would be, if provided by a pharmacist, paid for under health spending accounts. Now, we know those are not very common in the marketplace. There are only about 20 to 30% of plans offer these health spending accounts, but it was at least a first go at it. I know that there hasn't been a lot of uptake, and we've been pushing to have that document re-released soon through both CPHA to its members as well as OPA and the provincial association. So we will continue to push to make sure that document is re-released and worked on and continue to be refined, because that's very important that it provides pharmacists with a reference on what to charge for services if they're going to provide them. But we are constantly in contact with insurers and trying to get more scope, or not necessarily scope, more reimbursement on professional services with insurers. We do also talk about areas that are of concern to us, and the most recent one would certainly be the Pay for Performance program that came out from one insurance company. But I can tell you that OPA has worked very closely with that company, and also CPHA, with representation from your provincial association, has been working on what is the next steps in this space if it's going to be introduced in Canada, if Green Shield isn't just the first to implement it, if it's going to be implemented at a larger scale, We want to be the ones that are controlling it. We want to be the ones that are in the room deciding what those performance measures are and how they're measured. And at a forum in the fall of 2017, we did get commitment from Green Shield that if pharmacy was able to get together and we are able to provide these or set up our own system to provide these measures, that they would use a Canadian-based system, which I think was a big feather in our cap, that they've recognized that if we are able to provide the information to them, they'll happily use our set measures and goals. And so we do work on both of those areas. So we try to be progressive with insurers. It's obviously difficult. They have buckets of money. I know there's frustration that a lot of the generic pricing benefits them a lot, or expansion of provincial programs helps them a lot. And I understand that. They do have buckets of money, and they're very the purse strings are very tight with them, and it's hard to sometimes get in. But we do work with that and try to be innovative and progressive with them, as well as we do react to areas of concern that we think our members would be affected by.
Thank you very much, Mike. The next question, it's a meaty question. Where's OPA at with advocating for the funding model and expanding scope? Alan, could you attempt to answer that, please?
Meaty is an understatement on that one, Andrew. Where are we at with advocating for funding model and expanding scope? We spend a lot of our time advocating in both these areas. Let me tackle scope of practice. And notwithstanding, the question earlier, there are still a very large percentage of pharmacists that would like to see their scope expanded, taking on new roles such as being able to assess and, if necessary, to treat for common ailments. We hear from our patients every single day that they can't get in to see their family doctor. No disrespect to the doctors; they're exceptionally busy individuals. But quite frankly, minor ailments need to be addressed, need to be assessed, and pharmacists are fully capable of doing that. So we recognize your accessibility. Most often, you get patients coming in late hours, outside of doctor's hours. So you are the most accessible healthcare provider, and we've made that abundantly clear to the provincial governments. We've demonstrated, we've shown them. Everyone's seen that chart that CPHA has put out, and we have a version of it that looks at the comparable scopes of practice across all the jurisdictions. And Ontario is still the have-not province. There's still a lot of services that are being provided in other jurisdictions, and we are still waiting for our turn and our day in the sun, looking at making therapeutic substitutions, prescribing, as I said, for common ailments, ordering and interpreting lab tests. That is fundamental to the work that we do in terms of monitoring pharmacotherapy. These are very simple fixes. These can demonstrate tremendous value to our system. And it's one of the reasons why we're seeing the initiatives such as what Mike was talking about, looking at value-based pharmacy, looking at quality measures to reimburse pharmacy. Payers are starting to want to see value in the work that they are paying for, the services that they're paying for, and yet we're still trying to work with a model that is focused on dispensing. So we're talking about bringing us to the table, talking about things like value-based pharmacy defined by pharmacists, not by insurers or by payers, but let pharmacy working with government to help define the value propositions. A question has come up quite often about billing numbers and what's OPA doing about individual billing numbers. We did, this is going back several years, we did a very large survey of our members to look at and dissect the complexity that comes with billing numbers for pharmacists. What we heard loud and clear was that while the concept is is very well accepted and supported. The complexity of individual billing numbers, both from a pharmacy side and from a government side, are quite large, quite massive. So this is certainly not off the table. It's still a topic of discussion that we will have with government, but we're looking at all different options. Options such as capitation. These are not necessarily our recommendations, but certainly all valid options to look at. What we do know is that our funding model right now as it sits is not effective and needs to be changed.
Thank you very much for that question, Alan. The next question, someone that is running a pharmacy. This is a simple question, Mike, I hope. Are there really people being hired in a pharmacy at minimum wage?
At the old minimum wage? Certainly. I mean, or at the new minimum wage as well. Yes, people are, I mean, I don't want to speak on behalf of every pharmacy owner since I don't, and again, it's very regional. But I know that pharmacy assistants are typically at or just above minimum wage, especially if they're a new hire. That seems to be very commonplace. Obviously, as a staff member gains experience, or if they come with experience or training, then you consider higher wages. So, but it's not unusual to see at least some, pharmacy assistants being closer to minimum wage if they're a new hire. But again, it ranges from area to area, and it would be impossible for me to speak on behalf of every region on how they handle that. But it wouldn't be uncommon to see it, I guess. Great,
thanks, Mike. Another question I'm going to ask Mike is the National Pharmacare. We're hearing about National Pharmacare. What is OPA doing to advocate for the correct model? Can you comment on that, Mike?
Yeah, certainly, Andrew. Pharmacare is obviously a very complex conversation, and it needs to be the biggest push from ourselves provincially with governments, and also through our national body with CPHA, is that given its complexity, it needs to be treated very with a very structured approach, and making sure that any conclusions or any directions that come from any decisions are well thought out and not just done for political reasons. And so in terms of National Pharmacare, you probably don't hear a lot per se from OPA directly, and that's because we're using our national voice of CPHA to speak on behalf of us. We as OPA are a member of CPHA, and we do have a board member on CPHA, and we utilize that direct relationship with our national body to make sure that our voice is being heard and they are speaking on a federal issue. The biggest thing that really we recognize is, yes, there are Canadians and people in Ontario who do not have drug coverage, and that we believe access to medications are important and that costs shouldn't be a barrier. But we also believe that we should be addressing the concerns of the people who do not have coverage and not looking for broader-based coverage if it's not available through proper funding right now. And CPHA has been very vocal on it in terms of their Pharmacare document, which is their national approach on Pharmacare. And I would encourage anybody to go to the CPHA website and learn more about their position on it. But their biggest outcomes that they want to see from Pharmacare is to improve access to prescription drugs, which I think we can all believe is a good thing. But another key is obviously the affordability to government. So this can't be something that is prescription drugs is a big bucket of funding across Canada, either through private, public, or independent paying. So we have to make sure it's sustainable long term. It has to be a comprehensive national formulary that improves equity and reduces inconsistency. So and we have to stop looking at these province by province solutions. Promotion of safe and appropriate use of prescription medication, and respect provincial and territorial jurisdictions in the area of health. So those are their 5 key elements to Pharmacare. So we do speak, and again, I understand that a lot of people kind of get frustrated when they think that OPA is not speaking on national pharmacare, but we are speaking through our national body.
Thank you very much, Mike, for that question. Here's another question that's come in. Do we have statistics on how changes in pharmacy practice has impacted healthcare to patients? You know, for example, flu shots, expanded scope, the benefit to the healthcare system. Alan, would you be able to comment on that question, please?
So what I can tell you, Andrew, on that, we actually just received some of the statistics from the Ministry of Health just a short while back, outlining some of the statistics, some of the uptake with regards to flu shots. I'm not sure if it was, I think it may have been mentioned in the opening commentary from you, Andrew, but it was, last year alone we did 1.2 million flu shots, or actually that's where we are at this year. We were actually 1.2. We've surpassed the just over a million from last year, and that keeps growing, demonstrating the public's tremendous support of pharmacy taking on more. Don't have stats. We don't have stats at all on vaccine administration. Those are housed within individual pharmacies because the vaccines that are provided by pharmacists are not publicly funded. There is no repository for that type of data, but we're trying to gather that from our our pharmacy members. But we can provide more statistics to our members with regards to pharmaceutical opinions, med checks. We know that med checks have dropped down, and we are hoping to turn that around with eventually a new and revitalized but a much simpler and operational med check program. So we will, the data that we just received, we will include that in our next OPA e-bulletin.
Thank you very much for that response. So question, with OHIP Plus, insurance plans have not indicated savings to plan member premiums. Could those dollar savings be allocated to pharmacy? What an employer does is ultimately their decision on how they provide benefits to their employees and how they manage savings. This may be a great call to action for our OPA members to help in talking with their patients and to approach employers, so that collectively we could certainly make a case for having employers either reinvest or encourage the insurers to provide coverage for more pharmacy services. So that's something that I think we collectively could unify and make a difference in that particular area. Another question that's come up, opioid crisis. What is happening on the opioid crisis file? Alan, can you talk about that, because you are a member of the Ontario Opioid Task Force?
Thanks, Andrew. Definitely, it's a question that commands a good portion of my time here at OPA. There is a lot that's going on, both within OPA proper, but also in the broader system. Let me speak first to the Opioid Emergency Task Force that I sit on representing OPA. It's a very diverse group. It's very engaged. Right now, the issues that are top of mind within the Opioid Task Force are issues related to illicit opioids, and particularly the crisis that we're seeing in terms of overdose on the street. Certainly, you're all very familiar with the take-home naloxone program, the Ontario naloxone program in pharmacies. We've demonstrated tremendous success in helping to distribute life-saving naloxone kits to anyone in the province, and that program was very recently expanded to improve that by enabling first the ability to distribute the intranasal naloxone as well as the injectable, but also the government has thankfully removed the obligation to collect an individual's OHIP information. We recognize, and we had flagged this right from the get-go, that while the program was good and life-saving, it needed to be adjusted because collecting OHIP numbers was a significant barrier for many individuals. Many did not trust the fact that OHIP information was not being used by government to identify people, identify users. This now, you in your discussions with individuals who may benefit, or if for someone who they are trying to support, if you're having a discussion about naloxone, you can remove that barrier and that fear. There's a lot of work that's being done at OPA with regards to what pharmacists can do aside from the distribution of naloxone kits. We are capable of so much more. Your training, your expertise, your knowledge of pharmaceuticals and on appropriateness of therapy, your knowledge of the patient's medical history, medication history. This is information that needs to be tapped into. Our ability to monitor patients' response to therapy. We are often, as with many other situations, we are often the chronic pain and acute pain patient's first point of contact when they're having a problem. Even if they've already been prescribed, you have the ability to have that quiet conversation with them on how to get better use out of their pharmacotherapy, or even if need be, make recommendations to the prescriber to adjust therapy. We believe pharmacists have the ability to adjust doses of medication, particularly opioids, to adjust medication doses down if we sense that the medication is too strong or is running the risk of potential overdose. Yet we are still having to go through each prescriber to request that and to make that recommendation. This is something that you do already with other pharmaceutical products. Why you should not be able to do this with opioids, it does not make logical sense, and we are advocating strongly. We're working very closely right now with Neighbourhood Pharmacy Association of Canada on a proposal that will leverage pharmacists not only in terms of their consultations and their ability to provide more timely counseling, more access to those acute and chronic pain patients, but also to look at adjusting doses.
Thank you very much, Alan. Mike, the next question, there's a few that I'm going to combine that I'm going to ask you to respond to. A individual online is asking, why does it appear that OPA seems to take the same approach with government, and are we advocating to raise dispensing fees?
Thanks, Andrew. It's a good question, and I'm going to try to break it up, I guess, in a couple parts here. First, in terms of the dispensing fee, we have advocated for a higher dispensing fee, and as recently as March, myself and Andrew were in Premier Wynn's office meeting with her health policy advisor, and we re-raised the issue that pharmacy in Ontario has the lowest dispensing fee in Canada, and that we believe that this should be increased. We want fair and responsible reimbursement from any government, and we will continue to advocate for that on all aspects of pharmacy. In terms of what we do with government and how we work with government, the key with this is, especially with a government that's in power like the one that is now, that is a majority government, there is risk. And I know that a lot of members have asked me in the past, why aren't we marching on Queen's Park? Why aren't we picketing and raising noise? What I can tell you from my experience on the board, and I've been a member of the board now since 2010, is when we did that in 2010, it's the effectiveness of it was questionable. It did get some media attention. It did raise awareness. But the reality is we did upset this government. And when you do that to a majority government, they can shut you out. And they did shut us out for a number of years. We've been over the last 7-8 years trying to rebuild that relationship and trust with government. I'm not saying we've been terribly successful on a ton of files, at least ones that people would start showing great respect for, but it's been a challenge. And that's the risk you run when you start making a lot of noise with government, because they have the power to shut you out. So we try to approach each file or each issue, if you will, with the government with how we think we're going to get the best response from government and not impact a long-term relationship with us, because there's a lot of damage they could do to us if they wanted. So we try to approach it like that. Every time, though, when we face big issues, those ideas, is this a time where we think that marching on Queen's Park is going to add value? And we try to debate all those different aspects of it. And recently, especially in response to the Pan-Canadian, we believe the better approach is getting out to MPPs and doing the MPP kits that have been sent out by OPA and trying to get you engaged with your local MPP and getting them on board and helping them understand. But this kind of ties into a second part of that I wanted to address, is that sometimes picketing or marching on Queen's Park isn't necessarily just for government. It's also for our members, because I know our members want to see us doing something and see us fighting for them. And I will say that we are. I will say we're doing a lot with government, especially over the last 6 to 8 months. Actually, I shouldn't even say that. For the last 4 or 5 years, especially once the 2015 changes were announced, we've been doing a lot of active advocacy with government. But it just speaks to, and we know this, that we need to improve on how we communicate our advocacy efforts to our members. It's important that you guys know we're working on your behalf. If it was something like the Employment Standards Act issues, if it was something like that was mentioned on pay for performance, how are we working with government to advocate on your behalf? And if we're not going to be loud in their face, so you can see us doing that, then we have to tell you how we're doing it to make sure you know we're working on your behalf. So we will continue to work on our communications to make sure that we are doing a good job letting you know what we are doing for you.
Thank you very much, Mike. That's about all the time we have for our presentation today. On behalf of Alan and Mike and the entire board, I'd like to thank everyone for joining us. I hope we were able to provide you with some of the perspectives and insights in the disruption that is facing the pharmacy profession. A couple of reminders from our webinar today. Check your email for the OPA Advocacy Kit that will give you further details on the issues we're fighting for on your behalf. As well, you'll find information about how to meet with your MPP or party candidate and how to get the most out of your meeting, and a recording sheet that you can send back to OPA with any action items. If you're not a member, you will not have received the advocacy kit. We encourage you to join, and we'll send that kit to you as soon as possible. Check out OPA's Destination Conference June 7th to 9th, Connecting the Dots at Deerhurst Resort in Huntsville. Our keynote speakers include Bruce Croxon, who will discuss how technology is transforming all industries, and you won't want to be left behind. Our second inspiration keynote address is from Melissa Sheldrick, who has turned her son's tragic death into a crusade for error reporting in Ontario and across the country. She'll provide us with a status of the highlights of the initiative to strengthen the profession. We also have sessions on medicinal cannabis, leadership, biologics, chemotherapy, toxicities, and more. Under the stars, we have a beach party, ice cream social, and a formal closing for you to network with your peers and families. But one thing to remember, if you are planning to attend this fantastic event, the conference kickoff is most likely on Election Day, so you will need to take advantage of advanced polling in your riding. And if you're not a member, join us and fight for the profession. Visit opa.com/professional/membership. Thank you for joining us tonight. We will be scheduling webinars with pharmacy community on a regular basis. Watch for the next one this summer. We will have a new government and perhaps new opportunities for discussion. Thanks again, and please don't forget to complete the survey, which will pop up right after you end your connection to this event. Good night, and thank you.